ladies and gentlemen, and welcome to another episode of the 286 Project with me, Chris Akers. And on this podcast, we talk about arts, culture, politics, sport, and anything else worth talking about. If you like this interview and if you like subsequent interviews, please don't forget to like, subscribe, and share, and all of that good stuff. Today's guest, we're going to be talking about a topic which I've had two other guests talking about, but from different perspectives. We're going to be talking about CTE, and we're going to talk about concussion in sports. My guest is he's a professor, he's a research fellow at the School of Health Sciences, Swinburne School of Technology. I hope I've got that right. Like I said, he's
Yep.
also a professor. His name's Alan Pearce, and he's here to talk to me now. Hello, Alan.
Hello, Chris.
Well, good. Nice to speak to you. Like I said, I know you're very busy, so I really appreciate you coming on. Before we get into the crux of the conversation, because today's conversation, like I say, is going to be about concussion in sport and CTE. And also talk a little bit about motor neuron and disease in sports and how that can be caused by head collisions. Can you just explain a little bit about yourself in terms of your areas of research and why you decided
Mm.
to get into this area of research?
I've been a neuroscientist or technically a neurophysiologist for nearly 25 years now.
Mm.
I grew up in Perth in Australia on the west coast before moving to Melbourne. And there I did all my sort of studies, my undergraduate and my PhD. And during the time of my PhD, I learned a technique which I still use today in my concussion and CTE research, known as transcranial magnetic stimulation. So that sort of sent me down the pathway of being a neurophysiologist. And we can talk a bit more about the technique in context of the research down the track. But I had got interested in brain injury during that time, and at that time, in the sort of mid to late 1990s, it was more around recovery after stroke and what can we do to help people post stroke, because at that time there was very little being done. And we were also understanding this sort of concept that we now take for granted called neuroplasticity. So we were learning how that happened and what was, the mechanisms for that, because at that time it was still very much, neuroplasticity was just a concept, and there was no evidence and all this sort of stuff. So that's kind of where I originally wanted to go down. But when I moved to Melbourne, after a period of trying to get my foot in the door, I got a chance of working with brain injury patients at one of the hospitals. But unfortunately, it wasn't going so well because the patients that I was getting from the research were just everywhere, and so it was very hard to try and to do a scientifically rigorous study. So I moved to another university where I met a PhD student who was playing football, and he kind of sort of casually said, "Have you thought about concussion?" And this is around 2010-ish. And I said, "Yeah, that's something that would be of interest." Around that time, there was this strange disease coming out of America called chronic traumatic encephalopathy. No one knew anything about it. It seemed to be only with American footballers, but there was speculation that this could be something that might be occurring in all contact sports. And so I sort of jumped in that direction quite serendipitously around that time. I met some key people who knew players, Australian rules football players, who were struggling with cognitive issues and behavioural issues and things like that, who then sort of became quite supportive of my research and um, sort of started sending me players, and so things sort of went down that track. So from about 2000, excuse me, about 2011, 2012, I have done nothing else except concussion and CTE research, which is literally every day of my life now. So it's been a real life changer for me. Yeah, look, 15 to 16 years later, I'm still doing this research and talking about it.
Cool. So when I've interviewed people about this before, because I've done a couple of interviews about this topic,
Mm.
was from the perspective of a journalist who wrote a book about rugby union's attitude to CTE in
Sam Peters?
Yeah, St. Peter's, yeah.
Yeah, great guy. Yeah.
Yeah, great guy. Very good book. I'd highly recommend it. And then I
Mm.
interviewed someone else named
Yes.
Gary Turner, who, there it is, Concussed, yeah, indeed. Indeed. Yeah, it is an excellent book. And even reading the book and speaking to him, it was very shocking, like the attitude of people even back then,
Yes.
to it. And I spoke to someone after that called Gary Turner, who
Mm.
has studied the as well, but from a martial arts perspective as well, boxing
Yes.
perspective. So I know a little bit about those sports and in the UK in general, but what's the attitude to CTE sports in Australia?
Well, this is this, the attitude that obviously Sam has spoken about is something that is worldwide. There's this real hesitation about the, short, long-term effects of concussion, the long-term effects of what we call subconcussive neurotrauma. So these are the impacts that don't create a concussion per se, but are certainly significant enough to damage brain cells over a long period of time that then increases the risk of CTE. And there has been a real hesitancy to try and accept that there may be that there is a, sorry, I should say not maybe, I'm talking like them now too, that there is a association between repetitive impacts to the head and uh, you know brain disease later in life. And even the most recent consensus statement, international consensus statement, still hasn't gone far enough in terms of acknowledging that risk. With words like possibly, maybe, um, poor scientific evidence, low level scientific evidence, things like that. So, um, and very much a lack of research funding being put into this. So when there is research funding, it's all about concussion and diagnostics around concussion. Can we diagnose someone with a concussion on the field? But not any of the longer term stuff. And so this is something that is happening across a number of regions of the world. And I think it's mainly maybe because, and I can understand that, the sports are finding that this might be an existential crisis for them. If the sports that we love are killing the people that are playing it, that doesn't look good for the sports.
Yeah, indeed. Because obviously you've got Aussie Rules over there, that's big.
Yep.
You've got Rugby League, that's very big as well.
Yes. Yes.
And I'm just thinking of what know of or think I know of about Australian culture, this real macho culture, which
Yes. Yeah.
I know is providing like other countries as well, but it seems, especially in the Western world, Australia seems to be really like that as well.
Yep.
It must have been hard. It must have been hard for you to actually get people to take that seriously because of that as well.
Oh, yeah, absolutely. I mean, going back to the the start, where I talked about my, initial journey when I started to get players for my research program, it did start to attract media attention, and almost my first sort of experience into, media attention, I suppose you could call it, was a investigative journalism program called Sunday Night, and it was a special report by an ex-Wallaby player, uh, Peter Fitzsimons, um, and this particular report showed a rugby league player and an Australian rules football player who were both struggling. That one of them couldn't remember his kids' names anymore, and he was only in his 50s. um, and so it caused an absolute furor. And of course, when that happens, you get this very hard pushback. Um, and I had lots of text messages of people saying that the Australian Football League are laughing at you right now. And other people are saying you're just trying to destroy our sport. And this, it still happens now too, but certainly back in around 2012, it was fierce. It was absolutely fierce that someone would dare speak up, that there could be an issue here. Um, and so the best form of defense was attack, and so yeah, I was certainly attacked.
Yeah. It's bizarre. I'm just wondering, with and something I've always wondered with CTE, does it have a genetic component? And what I mean by that is, say if you have someone with CTE or is close to getting CTE, and then they become a biological parent of a child, would that child have be at higher risk of CTE because their parent is like
Mm.
had all those concussions and so on and so forth?
Well, that's one area of inquiry that is being looked at the moment. And it's funny you mentioned that the genetic component because only 4 days ago there was a significant research paper published in the journal Science suggesting that there could be a what we call an epigenetic risk, um, where the environment of physical impacts to the brain seems to be increasing risk of CTE in players that have certain particular genes, and we've still got to identify what those are. But I think there may well be, some genetic component because one of the questions that we have is why do some people develop CTE and others apparently don't? And so that does point to a genetic component.
Yeah, you sometimes see in boxing as well. I mean, I look at someone
Yeah.
say like George Foreman, who
Yes.
had nearly like over 70 fights at heavyweight, and yet
Yes.
by the end of his, I know he passed away late early this year, but towards the end, he was so lucid still, and used to take a
Yes.
lot of shots to the head and whatnot. Whereas
That's right.
you have other fighters who don't, who like have less fights, and like they're still having CCE issues, and so that
Yes.
seems. I know that's like a crude way of looking at it, but it seems to
Yes.
like almost back up your theory about the
Yeah.
genetic
Yes.
component to that.
Yes. So in boxing, we do know that the ApoE4 gene seems to be a key factor for a development of, neurodegenerative diseases like Alzheimer's and Parkinson's disease. And I don't know if the news got over to the UK, but certainly here in Australia with one of our Hollywood legends, Chris Hemsworth,
Yeah, I heard
was
about
doing a
that.
documentary and he found that he had the ApoE4 gene from both parents. And so he's now quite paranoid about the fact that, does he do stunts that involve, potential head injury, because he could be at risk. And so he's now on this path of trying to, you know, do everything he can for his brain health after finding out. But from my understanding is that the ApoE4 gene may not be as much of an issue in contact sports, where the impacts are incidental compared to boxing, where the impacts to the head are constant. So that's something that we need to understand as well.
You save contact stores the more incidental, but if you're playing rugby or as yours every
Mm,
week and you've not even recovered from like a previous concussion,
yes.
then surely that must have a cumulative effect.
Oh yeah, oh, absolutely. Yes. I guess we're talking relative, speaking of rugby and football codes compared to being in the ring and just getting punched in the head the whole time. Now there are, lots of indirect contact to the brain. Um, and certainly, what we're seeing from some of the data from instrumented mouth guards, for example, or some of the patches behind the ear or on the helmet, shows that players who've had greater exposure are also at risk. So it may well be, a genetic predisposition plus exposure, the amount of exposure, where you played in the team as well. So the research from Boston University is showing quarterbacks have a fourfold risk of CTE if they've played from, primary school right through to the NFL. But defensive linesmen who are right at the front, just copping the hits, have a 110-fold risk of CTE and uh, almost the same in getting, high stage CTE, so stage 3 or stage 4 CTE compared to other players on different positions of an American football team. So yeah, it seems to be it's going to be this sort of complex algorithm of when you started playing, how many hits have you had, both concussive and subconcussive? Do you have the genetic predisposition? Yeah, age, possibly gender as well. So yeah, it's We've got a long way to go yet.
I've heard, and I'm sure this is right, where in order to test for CTE, you can't fully discover if they have it or not until they've passed away and I have an
That's right.
autopsy. So,
Yes.
if with that in mind, what steps have been taken to test for it beforehand?
Yeah, and that again, that's another area that we're desperately needing support and research funding for because CTE is only a what they call a pathological diagnosis right now, as you said, only in postmortem. So there is a, I guess we could call it a preliminary criteria called uh, traumatic encephalopathy syndrome or TES. But at the moment, that criteria can only be used in experimental research. So if you came into our study, Chris, and we would screen you using the TES criteria, we would say, okay, you are in our B group because you played rugby or whatever, but you don't meet the criteria for TES. Someone else comes in, John comes in and meets the criteria for TES. We can put him in group A, and then we can try and study why are there differences? What are the differences for? But we can't use it as a clinical criteria for John to go to his local family doctor and say, "Have I got CTE?" And he goes, "Oh, well, this TES criteria says you have. So I'm diagnosing you with CTE." So at this stage, it can't be used for those purposes. It can only be used for research purposes. But, speaking to colleagues at Boston, we're getting close to a clinical criteria. So, close, it might be in the next 1 to 2 years that can be used because there will be hopefully some blood biomarkers as well and some imaging that can complement the cognitive testing and the behavioral testing and their history as well.
What effect does age have in the onset of CTE? In the sense of the age you have your first concussion, or
Yeah.
the age you first start playing like contact sports like a rugby, or even heading to football.
Yes. It looks like the younger you start full contact sport, the greater your risk because obviously you get greater exposure. What we're seeing now with the emerging research, and one of my studies I published a couple of months ago now, um, seems to show that the number of concussions isn't a factor for long-term problems or CTE. But what we are seeing is changes and CTE risk associated with how long you've been playing for. So generally, if you start playing full contact sport at 6 or 7 years of age and you continue through until, you either finish your professional career at 30 or whatever, that exposure is the risk. And particularly in the UK and in Australia, where we have the club sports system,
Mm.
many of our ex-professional players will go back to their local club and play for probably for another 10 or 15 years, just playing club footy, just for fun. So that's more exposure as well. So that's the other concern that we have. So it appears that, the younger you start, the longer you play. And potentially what position on that team you play, um, are certainly factors for CTE risk.
What's the differences between men and women when it comes to this sort of
Mm,
risk and the onset of
yeah.
illnesses?
We, well, look, to be honest, we really don't know yet. There is a lot of talk in the media around, women are at greater risk of concussion and worse symptoms and take longer. But the research is still relatively limited, and unfortunately, two reasons for that. One is that women have only really started to come into playing contact sports, particularly in Australia, only in the last sort of 10 years or so. So we're still lagging on a lot of that data. But two is that a lot of our research has been very male centric, unfortunately, and it's all been focused in on men, which, is wrong. And I'm hoping that now we're starting to see a more of a balance with that. But in saying that, there are a number of research studies that, do show that women have, greater risk of concussion, more I guess more and worse symptoms than men. But then there's also other research that shows that there is no difference as well. And one of my studies that I published again earlier in the year, I had men's and women's teams for football and ice hockey, and when they were concussed, the reported symptoms, how long it took them to recover was almost the same. Now, with the rise in women's sport, particularly professional women's sport, my worry is that there's going to become, as you sort of mentioned at the start, this sort of hyper masculine um, approach, and so the women are also trying to, I guess, wanting to try and demonstrate that they're as tough as nails. And so they're being like the blokes who we've tried to educate to say, you can't hide your symptoms on concussion. You can't downplay your concussion because you want to, impress the coach or, not let your teammates down. We can't make the same mistakes here because we've got an opportunity to have women play professionally, play hard, play well, but not, hide their brain injury because it can have such, devastating consequences.
Yeah, because I'm thinking again, like, basically boxing is my sport.
Oh
And
yeah.
so it'd be hard to test it because with men, like at the top level, it's 12 3-minute rounds. Whereas with women, it's 10 2-minute rounds. So straight
Mm.
away from
Yeah.
studies, like how can you compare?
Yeah.
Because one's like quite a few minutes long. So I know the
Yes.
women are trying to change that. So I think you might get in a few years a bit more fair comparison.
Yeah. Yeah. And I think, with the professionalization of sport, there may well be, equal, in terms of boxing, say, equal bouts, which then obviously from a scientific perspective, you can test. But at the same time, you're also now increasing the exposure risk and, what happens in 20 or 25 years' time where we see we sort of ask ourselves, what were we thinking? Maybe future generations will look at us and go, what the hell were you doing? The same way as that we look back at, say, ancient civilizations and kind of think, wow, they were killing each other in colosseums as sport, and we that's the sort of thing that does worry me that, are we sacrificing our athletes for entertainment's sake?
Mhm. I'm just wondering, with CTE, obviously there's no cure for it. Are
Yep.
ways of actually slowing it down once you know,
Mm.
or even something like Alzheimer's, where is there a way of actually slowing down the onset of it? You won't be able to stop it, but at least slow it down.
Yeah, I think once we've got a better understanding of how we can diagnose it in living people, then we're able to then, particularly also from a genetic component, we might be able to then start to develop novel therapies for that. The concern that I have is that, with decades of Alzheimer's research, we're still no closer to treating or slowing the progression down. The best we have for Alzheimer's is, exercise, social interaction, and cognitive stimulation. But that all goes out the window once you have a diagnosis of dementia because it's almost too late. So we need to be, I think if we can understand Alzheimer's better, we'll certainly be able to understand CTE. But at this stage, it's a little bit like, HIV/AIDS from the 1990s. The best prevention, best precaution is prevention. And we've got to try and reduce the amount of impact. Now, at the Australian Sports Brain Bank that I'm affiliated with as well, what we're seeing is that those who started sport at a later age, so 14, 15 years of age, do not develop CTE, whereas those who started at 6 or 7 years of age with full contact develop CTE. And so one of the things that we're trying to advocate for worldwide, so, we've actually brought out a CTE prevention protocol, which I'm happy to send you, where we try to, advocate for modifying sports for kids up to the age of 14 years of age. So they can still play their rugbies, they can still play their soccers, whatnot, but we take out the contact. Um, the analogy is that, as parents, people would, you just don't hit your kid in the head, 5 times, say 5 times a year. If you, hit your kid in the head, you'd be up for, uh, domestic violence, in terms of the way you treat children. But we seem to accept that we can take our kids to Saturday morning sport and they can have 5 or 10 hits to the head at sport, and it seems completely acceptable. So, we need to think about modifying sport till the age of 14 years of age. Maybe at 13 or 12, we start to teach them how to tackle in a controlled environment, how to be tackled, that sort of stuff, so that when they do graduate to the full game, they've got all this exposure that they've not had. They've missed that. We need to think about, and this has been talked about here in Australia, modifying training practices, which is what the RFU do with their professional teams to limit contact to 15 minutes per week maximum. So get coaches to coach smarter rather than just harder. Um, and we've also got mandated time periods after a concussion as well. So we've got to think about these things, and then we can still keep our sports. That's I think that's the problem that we have, is that we're not wanting to do, for me, the obvious, and we're going down these pathways of, oh, let's get um, a Q collar. Let's get a cooling cap. Let's get a mouth guard that can measure impacts. Let's get this. Let's get that. And it's, for me, it's almost like we're trying to um, develop technologies to allow people to still keep smoking. It's just, for me, it's almost as ridiculous as that.
Yeah, yeah. I'm just thinking. I know you mentioned it in terms of when you've spoken to people, either on TV or whatnot, about this, and they say you're killing the sport and whatnot. What other specific reasons do they give in regards to them not wanting to know at all about any of this?
Mm. Let's have fun. Let the kids have fun. Stop being, we call it in Australia, a Debbie Downer.
Mm.
You're taking away what people enjoy. Um, there's risk in everything. So why do we have to wrap people up and kids up in cotton wool and that sort of stuff? And you know, the way I respond to that is that um, if we put in some modifications, then if a player is concussed as an older adult, or sorry, as an older adolescent or a young adult or whatever, the concern is not going to be as intense, because they haven't had 8 to 10 years of exposure already. Um, concussions happen everywhere. People fall down the stairs, they get concussed. They knock their head on somewhere and they can get concussed. Car accidents. So, we don't stop people from driving or walking downstairs or anything like that. So we can accept a certain level of risk, but what we're saying here is that people are not fully appreciating what the concern is around the exposure. And so now, particularly in Australia, we have people who are very aware of skin cancers and very much, slip, slop, slap. We're not stopping anyone from going down the beach and lying in the sun, but we're not doing it like we did in the 1980s and 1990s, sitting in the sun for 6 hours a day every weekend, putting on cooking oil, to try and get that sort of tan. Um, and we look at that now and go, what were we doing there back then? So that, for me, is what we're trying to do. We're not trying to stop anyone playing sport. We just want to make it safer for everyone.
Can impact in sport, when you perform in sport and anywhere else besides the head, still have an effect on the head because of that whiplash feeling?
Yeah, yeah, that's right. So the definition around concussion is that it's a direct impact or an indirect impact that transmits force through to the brain. So when you do see, particularly in rugby and Australian football, you see this huge bump and you see the head, going forwards and backwards or sideways. That movement of the brain tissue is certainly what well, two things. One obviously causes a concussion, but two, it increases that risk of CTE through that stretching and the shearing of the brain cells. And so, yeah, you don't need to have that direct. And so, again, going back, to the early days of my research, I did a study back in 2015 where I was wanting to look at the recovery time after a concussion. And, I was working with a club football team, a suburban club football team, Australian rules football team, and, going down to their first game and, just sort of watching. And within the first 2 minutes, there was this, you know, um, player ramming into an opponent in his back, trying to go up for one of those, marks, the specky mark, and his knee hit the guy in the upper part of his back, and you could see the player's head just forward and back, and he just went straight down. And I said, "We've got to get him off." And everyone turned around and said, "No, no, no, he's not concussed. He wasn't hit in the head." And I'm just like, "No, you don't have to be hit in the head." And they're like looking at you like as if you're from Mars, like, "What do you mean? A concussion without being hit in the head?" So, that's the sort of, um, yeah, and many people still actually, don't. One of the myths around, concussion is that you have to be hit in the head. And, just like people still say, "Oh, well, he wasn't concussed or she wasn't concussed because they didn't lose consciousness." So, that's another myth that we've got to try and educate people.
Going on to motor neuron disease, obviously we had the case of Rob Borrow in the UK and what happened to him
Yeah.
and the impact that he was having. How much, what research have you done with regards to impact and the likelihood
Mm.
of getting a MN disease because of that?
Yeah, well, that's a good question because there isn't a lot of research, I guess, in terms of, exposure to repetitive impacts and the risk of MND. Now, the research we do have, again, from our friends from Boston University, have shown that there's about a fourfold risk of those who have motor neuron disease in those who play contact sports, and it's also associated with CTE, so they call it CTE MND. Um, the concern, obviously, is that we have a very high profile charity here in Australia called Freeze MND, and it was started up by an ex Australian Football League player, AFL player, a professional player, Neil Danaher, who's raised $150 million for MND research, and it's fantastic. But one area that is not being funded, and I've put in grants previously or proposals previously, is trying to look at that link. And unfortunately, uh, Neil Danaher, I don't think has pledged his brain to the Australian Sports Brain Bank. Again, we go back to the politics around a lot of this. Is that if there's um, any sort of links between repetitive impacts from football and rugby and whatnot, and MND risk. There's, it again, it could create a real political storm. Just like I've seen some, discussions on social media around, the latest rugby union player to get MND, and is it related to his rugby career or not? I mean, it makes things very difficult.
Just explain, because I probably should have said this before, just explain to those who aren't quite sure what motor neuron disease is, in layman's terms, what it actually is and how it can affect the body.
Oh, okay, yeah. So motor neuron disease is a movement disorder where you have, I guess, degradation or destruction of the neurons that connect the brain to the muscle. So,
Mm.
what it does is that it eventually, basically, slowly paralyzes all the skeletal muscles of the body. It's an awful disease to have, and basically just locks you in. So cognitively, you're still there, but from a movement perspective, the neurons, the brain cell, sorry, I'll say neurons because they're not just brain cells, but they're the pathways from the brain to the muscle basically die. And so, we need to understand more about the mechanisms of that, particularly with, why some people again get it and others don't. And again, is it genetic? Is it, what's the the environmental impacts as well on the genetics. But certainly with a lot of these neurodegenerative diseases, there are links to repetitive trauma. So, even Alzheimer's has links of a traumatic brain injury can increase your risk of Alzheimer's disease. Parkinson's disease has associated risks with um, physical trauma to the brain as well. So, we see a number of athletes, former athletes with Parkinson's disease, as we do with motor neuron disease. But, again, we need to see the brains post-mortem to see if there's any association there with CTE as well as Parkinson's, or is there CTE and motor neuron disease, or CTE and Alzheimer's disease? And so, this is something that we need to understand further, because what is the risk that we're seeing with physical trauma to the brain
Yeah. Doesn't it affect your balance? Is that one of the first symptoms where it starts to affect your balance?
for motor neuron disease?
Yeah, yeah.
Yeah, look, there's balance, also some fine motor control starts to get affected as well. So you start to notice that something's not quite right because you're not able to do the motor tasks that we take for granted. Um, so yeah, it does start obviously, small, and then starts to build up from there.
And what age do most people in sport normally get it? Is it normally towards the end of their career, or does it start like just before?
Normally it starts after they've retired. So there possibly is, well, particularly for CTE, we see that there's a period of dormancy. So a player retires at 30, and then in their 40s and 50s, they seem relatively okay. And then maybe in the mid 50s, then things start to go, very wrong. And same with, with a number of these other neurodegenerative diseases. So we need to understand, why is there this dormancy? What is it? Is there a particular threshold when there is enough, I guess, degradation of the brain that things then start to clearly show. Up to that point, there may be enough what we call neurological reserve for the brain to be able to continue to do tasks that people don't notice, or even the person themselves doesn't notice, until there's this tipping point. And we just don't know what that tipping point is at this stage. I mean, we've found CTE in here in Australia in people as young as 20, but they didn't have any signs or symptoms. And we only found it by accident because they died of another reason. And in this particular 20-year-old case, he died of heart attack from heat stress. So we were able to, and he never played. He was in a development squad um, for NRL, so he had never played at the top level. He was still coming through. He'd never been concussed, and we had found early stage, low stage CTE. In America, they've found it as young as 17. So it's developing, and this is the thing that we see, that particularly with CTE, it's developing sort of in the background. The player retires, still developing, but has no overt effect until it starts to take over the brain. Maybe in their late, sort of early 50s, mid 50s, yeah. And then
Yeah,
obviously, I should say, in some in their 40s. So yeah, that's why it's so difficult, because everyone seems to be different.
yeah. It just seems a very sudden. It seems a very sudden disease, motor neuron disease, because I think with Rob Burrow, not long after his diagnosis is when he passed. I'm not sure how
Yes.
many years, but I don't think it was long. Is it a couple of years, 2 or 3 years from diagnosis?
Yeah, yeah. It's only, I think the median time from diagnosis to death is only maybe 15 months or something like that.
Wow.
Um, but there are, obviously there are different versions as well, because Neil Danaher in Australia has had MND for nearly over a decade. So his progression has been very slow, as opposed to others like Rob, who've passed away fairly quickly. And most people do, unfortunately.
Does diet have an effect in terms of slowing down that progression as well? Like, say, if you say high, I
Yeah.
don't know, for the sake of argument, high in salt or anything like that, would that just speed things up? Or
Not sure about that. I think, I don't think we've really cracked what nutritional um,
yeah,
uh, risks are. But one of the things that we are trying to talk about in terms of brain health, particularly for the footballers, is trying to increase their omega-3s. And generally speaking, most people don't eat enough omega-3s. So that's something that we're wanting to look at as well, because it seems to have a positive effect after a concussion as well. So we haven't done any human studies as yet. Tried to get one up, but it fell over. But certainly in animal studies, we've seen that mice who've had, a traumatic brain injury, but then given high dose omega-3s, almost 10 times the daily dose, do really well in their recovery. And with their little tests and all that, they do much better, significantly better than those who have no nutritional input. So, there's again areas wide open for this area of research that are just not being explored right now. And so I sort of feel terrible when I have to keep saying to you, Chris, I don't know,
yeah.
because we really don't know. And this is why it's so frustrating.
Cool. We've talked about how these illnesses affect people physically. What about mentally as well in regards to
Yeah.
your CTE? Obviously, from my boxing background, you've had cases where boxers have actually committed crimes, even murders, because of the
Mm.
punishment they took as well. I imagine that's
Yes.
being the same in some Australian studies as well.
Yes. Yeah, absolutely. So the difference between CTE and Alzheimer's is where it starts. And this is why it's sort of related to physical trauma in the brain. Because in Alzheimer's, the release of this tau protein, and tau is a protein that's very important in maintaining structural integrity of the brain cells. But when it's released into the brain, it becomes toxic and starts to kill the brain cells. So in Alzheimer's, it starts in the very deep parts of the brain that affects memory. And so that's why with Alzheimer's, you get a more, I guess, a stereotypical response in terms of memory going and things like that. And you can be more confident in diagnosing Alzheimer's in living people. But with CTE, because of the physical trauma, it starts in the outer part of the brain, the cerebral cortex. And while it might be mostly in the frontal part of that cerebral cortex, the frontal lobe, it can start in different parts. So that can be affecting personal, your personality, your decision making, your mental health in different ways. And so we find a lot of families talk about their loved one who, went off this direction or who went off in that direction. And they go, oh, your brother or your father or son or whatever had this. Well, my, brother or son or father had this. And so it's very difficult. And so while it can affect, mental health, and it can affect mental health in different ways, and it does show up as mental health. And so we have to keep reminding people that these people who've been diagnosed with CTE had a brain disease, because one of the issues around the, I guess, the obvious signs is mental health concerns, depression, anxiety, aggression, irritability, whatever. It then gets mistaken as a mental health issue. And so we start to try to treat these people from a mental health perspective, which doesn't work. I really hate to say, the families who talk about they go and see their psychologist, or they've gone to see a psychiatrist who's, given them depression, antidepressants, hasn't worked, who's given them repetitive TMS, hasn't worked, has given them ECT, hasn't worked, because it's not a mental health disease or condition, it's a brain disease. And so whenever I'm not sure what it's like in the UK, but certainly in Australia, we have um, games that have been dedicated to those who've passed away with CTE, but unfortunately, they dress it up as a mental health issue. So they have these games that raise funds for the Black Dog Institute to look at mental health. We have former players on the big video screen saying, "Talk to your mates. If you're not feeling right, talk to your mates." And this gets a lot of families of those who died with CTE very upset, and plus, myself as well as a researcher, that it's being misrepresented as a mental health issue. Um, because these people were talking to every single person they could for help. They were until the very end where they just went really quiet and then did something catastrophic to either themselves or other people. Um, and so, this is why research is so important into CTE because we've got to try and be able to treat the mechanisms of CTE, not the symptoms of mental health.
Yeah, yeah. I'm just wondering, with America, obviously the NFL had that big payout where they had to do that.
Mm.
The
Yeah.
similar actions in the UK with various sports. Is there a moment like that in Australia where not necessarily a payout, but where people are saying we've really got to do something about this?
Yeah. Yeah. Well, there's a case, there's a class action actually occurring here in Australia with AFL.
Okay.
So, which I'm not involved in. From my understanding, is that they're now at a negotiation. So we might see a settlement payout. I don't know. But it's it's talked about a lot, and maybe this is my bias, but we seem to have we seem to be talking about it a lot, but we're not doing a lot about it. Um, because again, it's getting misrepresented in terms of concussion. So even the class action here in Australia, they're talking about it as being a concussion class settlement, not a CTE class settlement. Um, and also the issues around mental health. So let's raise money for our mental health charities to help these players. And it's like, well, we're still being, yeah, misinformed around this. And as I said earlier in the podcast, all the research and all the funding into research is really going into concussion diagnostics and ignoring CTE. So, we desperately need um, funding research and support into CTE because things haven't really changed in terms of modifying sport for kids. Training practices haven't changed. Everything's talked about with concussion. We every time there's an announcement of CTE here in Australia, whether it's in rugby union, rugby league, or Australian football or soccer, um, the sports will automatically spin the message back to, well, we have concussion protocols. Athlete health and well-being is our greatest priority. We have mandatory timeouts now after concussion, and completely forget the CTE issue. So that's that's what I'm trying to raise awareness of is we've got to get people to understand what CTE is.
Yeah, it's how effective are those cushion protocols, or is there a lot more work need doing for them?
Well, I suppose you're aware of what happened in the test match 2 days ago in Tonga with Eli Katoa.
No, remind me because I think I've missed that. Yeah, yeah.
Yeah. So Eli Katoa was representing Tonga in the test match against, I think, New Zealand. Anyway, forgive me on that one. Um, but he sustained a fairly significant impact to the head in warm up. And there's vision everywhere about it. Like it was a warm up. His teammate came in accidentally with a shoulder, smashed Eli's head, went back. He went down. He was dazed. There are unconfirmed reports that he had a tonic seizure with that fencing position. I didn't see that, but that was some of the reports. But he was cleared to go and play the game. He got a second concussion in the game. Um, was cleared again, had a third impact to the head, which was very innocuous, just a slight knock to the head. He went down. They took him off. They put him on the side, on the bench on the side, put a wet towel behind his neck, and there is vision as well now of him turning to us, whether it's a medical staff or a staff member, and just said, "I'm and then went into a seizure and started collapsed. Ended up having surgery to reduce intracranial pressure, fluid on the brain. He's now in hospital. So when we talk about concussion protocols, we need to do better in this because there's still a lot of subjectivity and doctors are doing their best job. I'm not having a crack at any doctor at all, but it's still a very subjective decision made by the doctor to say, Chris, you're good to go back on, or Chris, no, we're going to take you off. They talk about the head injury assessment. Again, it's a paper and pencil test. But again, it's still dependent upon the doctor. So the doctor can go, yeah, look, your head injury, the SCAT, for example, the sports concussion assessment tool says, oh, you've got some symptoms, but I think you're okay. I know what you're like, so you can go back on. Or, it could be, oh, look, you've done everything right. You have no signs or symptoms. You've checked off all the words, but I don't think you're quite right, so I'm going to keep you off. So it's very, very, still very subjective. And so we need to have better rigor in that. And there's also disparity between the sports. So the AFL have different protocols to rugby league, who have different protocols to World Rugby, who have different protocols to FIFA. So we need to standardize this more because a brain is a brain, irrespective of what sport you play. And in one sport they will let someone back, and then other sports they don't, and they're all jockeying for positions on saying that they're world's best practice. But it's nearly 2026, and a player like Eli Katoa should not be in hospital relieving pressure on the brain because he's had three concussions in one game.
Yeah, indeed. Just quickly, because I've got a couple more questions. The
Mm.
tau protein, you said when that's released in the brain, then that's when the problems occur. I'm
Yeah,
just wondering, is that tau protein released anywhere else? And I'm thinking that in terms of testing for whether you've got CTO or whatnot, does it get
yeah,
released in the blood? Does it get released in sweat? Is there ways of using
right.
that to like as a way of testing for it?
Yeah, yeah, you can test for it in blood and also in what they call cerebrospinal fluid. So if you do a spinal tap, you can see the tau floating around. The problem is in terms of, is it CTE, or is it frontotemporal dementia, or is it vascular dementia, or is it um, Alzheimer's disease? That's the problem. So whenever a player says, I've been diagnosed with CTE, we don't know that. We actually don't know what it is. And so the best case that we can do at the moment is someone like Steve Thompson, where he's been given the diagnosis of dementia with a what they call question mark suspected CTE. So at this stage, that's the best that we can do. It's very low confidence. We really don't know, but there's certainly showing, players are certainly showing signs and symptoms that there's something not right. But we can't determine what sort of dementia it is. And so protein, tau protein floating around could mean one of a number of things. And that's where we need to get better with, biomarkers like that, with, say, imaging, that we can see where the tau is starting and spreading. And then there's some preliminary evidence that PET scanning can do that, but we need to do more to confirm that with autopsy to say, yes, this now we know what we're looking for.
What can clubs do to like minimize the damage? I know you've mentioned some with regards to training and
Yeah.
not heading the ball from when
Yeah.
you're so young. What else can they do?
They can change the culture. I mean, they can certainly change the culture. So, this culture that you've got to run through walls, um, needs to, and almost this militaristic approach to sport. Yeah, go out and play to win. I mean, I'm not telling anyone that you can't go out there to play to win, but if you're not there to try and destroy someone's body or someone's brain, we have to have some sort of limit to say, you know what, um, we've got to bring you off. Or a teammate says, oh, Johnny over there, he's not quite right, let's get him off. We wouldn't accept that in other areas. In work, if someone at work is not quite right, we've got to get you, we've got to help you. We've got to get you to the hospital, or we've got to get you home. And we talk about, athletes talk about the fact, oh, if I'm not 100%, then, I can't play, particularly if they've got a hamstring soreness or, a knee issue. Look, I'm not quite right. Better to get a fresher player in who's ready to go. But for some reason with brain injury, we think, oh, no, no, well, we're fine, because it's a invisible injury. So people don't appreciate what might be happening. Um, in Australia, at least, I think, we know in the AFL and AFL women's, the professional leagues that, more than 1 in 10 players still hide their symptoms from doctors, and doctors can't pick it up. So what is going on out there if you don't even know who you're playing or in which way you should be running or kicking, you shouldn't be out there. And so clubs have got a real role in educating and changing the culture around that. If you're not quite right, then we need to take you off and get a fresher player in. It's okay to say that you're not feeling quite right, from a headache or sore neck, or you're nauseous, or you don't have your imbalance, balance isn't quite right.
Mhm.
Um, it's a culture change more than just an educational change.
Alan, it's been a pleasure talking to you. As I said at the start, I've spoken to other people about this topic and I've read books about it as well.
It's
It's
great.
always fascinating to hear about it from different perspectives. So thank you for coming on to the podcast. If people want to find out more about your work, where can they go?
Well, they can go to my website, neuropierce.com. Also go to Concussion Legacy Foundation Australia for the work that we're trying to do in raising money for CTE and concussion. And also have a look at the Australian Sports Brain Bank. So it's brainbank.org.au. And you can see all the work that we're trying to do in this space as well. So yeah, really appreciate having a chat today, and thank you for having me on. And I hope you don't mind me ranting too much, but yeah,
No,
it's
it's been a pleasure. It's been a pleasure. It's been a
I
pleasure.
I'm known to do that a little bit because I just get a bit frustrated. But it's always good to be able to spread the word about this to as many people as possible, because it affects so many families and friends and family and people as well.
Well, cool. Well, hopefully the attitude and the research will develop in the next 5 to 10 years so that we're not having these conversations then. So fingers crossed for all that.
Great. Thanks very much.
Cool. But thank you for coming on to A6 Project. It's much appreciated.
My pleasure.